Dr. Chang. Dr. Shu is a world-famous Chinese vascular surgeon. He's currently the Chief of Vascular Surgery at the National Cardiovascular Institute at Fuwai Hospital in Beijing, and he has vast experiences in treating the thoracic aorta, in particular aortic dissections in China. So he's going to address us on the use of chimneys, fenestrations, and hybrids, and which of them would be the best. Dr. Shu.
Thank you, Dr. Chang. So good morning, ladies and gentlemen. So it's my great pleasure to be here to talk about management of aortic arch pathology. As you know, walking into hospitals, so we have lots of patients. So just according to the count of tubes for aortic arch, just like all our presenters talk about, including the open valve, high rate, and total endo procedures. So that's the total volume of Fuwai Hospital. So when we find it, last year nearly 1,500 aortic cases. Among these cases, there are more than 500 total endo, another 100 is hybrid, about 900 are open surgery. So that's my personal experience. In Fuwai Hospital, we find it, the aortic arch is nearly about 13% of the whole aortic pathology. Also, to my personal experience within these 3 years, so we have totally nearly 500 TIVR cases. Among all these, there are more than 500. Most of them will be done by chimney and fenestration. As you know, the fenestration including the in situ and the on-table fenestration. So as we know, the total aortic arch replacement now is a standard procedure for this disease. The hybrid aortic arch replacement now is so commonly used in China, especially in Fuwai Hospital. So more and more cases will be done by this procedure because it can prevent lots of complications after open surgery. So that's a simple case we have done for hybrid aortic arch replacement. So it can reduce the operation time and reduce the complications, especially for bleeding. And the liver function, kidney function will be much better. The different kind of debranching are procedures for aortic arch, but anyway now, just a few hospitals in China will do the debranching. Most of the cases will be done by hybrid or total endo procedures. Also, the bronze sling rod had already been used in China, especially with micropore device. But anyway, the micropore device is just a single arm standing rod, still not so commonly used. But anyway, the short-term result is perfect. Now, in China, too many fenestration procedures has been done. So to our personal experience, especially we prefer the on-table fenestration with a special device. Of course, not all the aortic arch pathology can be done by on-table fenestration. So we can select the right case to do this procedure. As you know, in Fuwai Hospital, it's a combination with the cardiovascular surgeons and vascular surgeons. So we can select the right case to do by on-table fenestration, sometimes even a balanced subclavian artery with a 3D reconstruction, so we can do it very precisely. So also we can perform the small on-table fenestration. As you know, if you do on-table fenestration, maybe the fenestration area cannot be 100% to be precise to the branch vessels. But anyway, if this fenestration is partial or precise to the branch vessels, for example, 13%, even 16%, we can put the wire inside, deploy another stent to revise it to be 100%. So that's why on-table fenestration can be selected for such kind of special cases. For example, such kind of cases, even we can do on-table fenestration just from the one approach from the femoral artery. You can put a device from the femoral artery to the left carotid, even the elongate, and left carotid. So this for the double fenestration, just from one side, from the femoral artery to deploy the 3 stents to the aortic arch. So even the whole aortic arch, elongate, left carotid,